So earlier, when daratumumab was first approved, it was given as an intravenous infusion, and patients would have to stay in the hematology clinic for pretty much the entire day. There was also an increased risk of infusion-related reactions, which required quite significant pre-medications for this treatment. With the advent of subcutaneous daratumumab, this became a much more tolerable, I guess, tolerable logistics for the patient, because a subcutaneous injection is just a few minutes, and that would considerably shorten the amount of time that a patient is sitting in clinic getting a treatment. We also found that maybe the infusion-related reactions were a little bit lower with subcutaneous daratumumab. Now, in terms of optimizing that even further, our group discussed together and decided that we would try to make some changes that would help to improve even more the logistics of giving this great treatment for our patients with AL amyloidosis. And we found that giving subcutaneous daratumumab, in addition to having a standard 30-minute observation period, as opposed to several hours, which patients were previously getting, was actually just as good as what was done before. And we did not see an increased risk of patients having infusion-related reactions, even just with the 30-minute monitoring period. We also tailored our pre-medications. I know Montelukast was previously used very much as one of the medications that prevents infusion reactions. This is something now that we use at the provider's discretion. Another part of the treatment was giving dexamethasone a few days after the daratumumab injection. We didn't find that made a significant difference in patients getting these infusion-related reactions, and so that was also based on provider discretion. In summary, we shortened or made the pre-medications a little bit less complicated. We shortened the observation period, and we completely moved to subcutaneous daratumumab, which has been wonderful for both providers and patients in terms of the monitoring time and just the tolerability of receiving daratumumab.